Good evening, ladies and gentlemen. Welcome again to the Social Health Insurance webinar series. Today, we're going to discuss registration and means testing. So before we have Stephen Kaboro, we'll have with us Dr. Mandela, who's one of the team lead in terms of registration, who is going to clear out most of the questions through showing us how to do the registration, how to onboard dependents, and what are the requirements we require to have so that we can understand this thing better. So, Dr. How are you? Mandela.
Fine, thank you. Thank you, Dr. Mina, for the invitation. I
Yeah,
hope everyone's well.
Yeah, thank you. Thank you too. So I think you can screen share from your end.
Yes, allow me to share my screen.
Yeah, kindly. Just go ahead.
Okay.
Nelson, you need to stop sharing.
Okay, yes.
Go ahead, Dr.
Can you confirm if you can see my screen?
Yeah, I can.
And you can see the presentation on the screen?
Yeah, clearly.
Okay, thank you. Good evening, everyone. Allow me to just take you through the registration journeys in relation to SHA and also in relation to the digital superhighway, which is an endeavor by the Ministry of Health to ensure that each patient is uniquely identified in the superhighway, but more importantly, that the healthcare data follows them when they go to points of care. And simultaneously, they can also register under SHA. So as you can see here on the slide, there are 5 registration channels. The first channel is the USSD channel, followed by the sha.go.ke website, as well as the Afyangu patient client portal, a sister journey which is predominantly for SHA agents and CHPs, and then lastly the employers portal, which enables employers to add their employees under SHA. One key thing to emphasize on is that the entire journey is focused on ensuring that all patients are uniquely identified. And in the superhighway architecture, they're essentially under what we call the client registry, which allows them to be uniquely identified from a principal perspective, but also the dependents as well. So I'll just go into the USSD journey, which is the *147#, which allows people to self-register. And in this case, if you dial *147#, and you enter your Kenyan ID, you will then proceed to set up a PIN. Here, you will essentially be indicating your civil, disability, and employment status, and also acknowledging that the details that you were shared or has been shared through this journey is correct. Just highlighting how this looks on the 4-digit PIN. Simply after dialing *147, you would set up a PIN that should be easy to remember. And an important thing to note is that this PIN should not be shared with anyone. We also do understand that not many people might understand or remember their pins regularly. So there is a use case where we can actually ensure that these pins can be reset, both for those who do not have smartphones or phones at all through their sister journeys, but also more importantly for those who have self-registered, who have access to internet as well as smartphones as well. Just highlighting the process of registration in determining or declaring your employment status, civil status, and living with disability. This is important, especially when it comes to us or SHA understanding the different kinds of demographics that would be covered in this case, but also more importantly within the digital health superhighway and the UHC vision, so that we can appropriately also take care and cater to those kinds of individuals. Post indicating your disability, civil, and employment status, you will then simply attest that the information is true and accurate, and then thereafter you will be able to get an SMS indicating that you have fully registered for SHA. Allow me to go to the web portals, and here we have two web portals. One is sha.go.ke, which is the SHA corporate website, where anyone and everyone can access all the registration capabilities under that website. But we also have the afyayangu.go.ke client portal, which essentially also provides additional functionality, where you can edit your details, add spouses and dependents. You can undergo means testing, similar on the sha.go.ke website, as well as also access your medical records and history, all in one portal. And we are essentially now also working on ensuring that there is a unification from these two web portals into one ecosystem. So simply, once you attempt to register by clicking on the registration or sign up links on both portals, you will be taken to a page where you will essentially uh, confirm your details. These details are essentially fetched from National Registry Bureau databases for everyone who has an ID. At the point of registering, you'll be required to put in your phone number and your ID number, which will send you an OTP code, which will then take you to this page. The OTP code is just essentially to confirm that that phone number belongs to you, or the person who's registering in this case. You will see your details as per your ID, and you'll also go through a set of questions in terms of indicating your employment status, your civil status, and also whether you're living with disability, as indicated in the previous workflows for USSD as well. But additionally, you can also enter additional contact information, like your email address, your phone number, physical address, and your postal code, which will also be linked to the county of residence, which is important because this can also be linked to your primary care network, as highlighted at the bottom, where you'll also have visibility of the facilities within your primary care network as well. Beyond this, if you've already set up a PIN in USSD, you'd have already registered. So in this case, when you're coming to these portals, whether it's Afyangu or the sha.go.ke website, you'll essentially be logging in. But if you're a first-time person who's registered, you'll have to set up a PIN on the portal as indicated here. And this is important because it will allow you then to ensure that any data that is available on your portal as a patient or as a client will be safe and secure. But we also provide for the possibility of resetting it in the event that you forget it. And as soon as you register, you'll get into this page where you will be able to have a visibility of your application status. In the case where you need to also validate with biometrics, you will be shown how to do so. Currently, we're working on avenues through which ease of biometric validation is done. And you can easily go to your Afyangu or client portal profile by clicking on the button as highlighted as well. And then when you go to your Afyangu page, you'll be able then to add dependents. So as you can see here, this is just highlighting the person who had registered. The key thing of importance is to get to that page, you have to go to my profile. Then once you get to the dependents page, you can then add a dependent. Here you can add a child or a spouse, and we've also integrated with NEMIS so that if your child is already registered under NEMIS, it will easily pull that information and populate it on the page. And then you can then proceed to add additional details, as you can see here on the form. The form clearly indicates the age group of your dependent, in this case, whether they're below 18 or above 18, but below 25 years. Under regulation that defines a dependent. You'll add the date of birth certificate number. We also are aware that people do not always have this, especially at a community level in rural areas. So we also have the assisted journey, which allows them to essentially forgo this step, but still add the dependents as well. You can add as many dependents, and we also appreciate that in certain communities you can have more than one spouse, and you can also do the same when you're adding those details on the Afyangu portal. As soon as you fill in these details, then you'll see the details of your dependent and spouse visible on this page under your profile, meaning that even when mapping to see who your principal or your dependent is, it's quite possible for you to have visibility of the same under your profile. Next is the employer portal. As mentioned, the USSD channels and the web portals are for self-registration, but we also appreciate that employers would want to add their employees, and the employer portal essentially is supposed to aid that capability. And I'll highlight a few pages that are on the website that allows you to do so. So this enables employers to add employees, define the contributions, and instead of doing it as per individual, you can also batch upload your entire population within the employee space. Allow me just to show you or showcase the portals as indicated. So this is the sha.go.ke website, which, as you can see here, has the employer link in the event that you need to go to the employer portal, which I'll show next. And as you register or log in, it will take you to a page where you just need to then proceed and add your details. I will not proceed because I've already registered, but I recommend that you go through this page as well to self-register. And in the event that you need to register a loved one as well who may not be as tech savvy, you can do so on their behalf, though we also have an assisted journey that enables them to do so. And log in, you just simply need to add this your phone number and your ID, and you'll get an OTP code as well. This is the Afyangu client portal. Simply, it's a page which allows you to then also do the additional things. Just to also mention, if you register on USSD or on sha.go.ke or even on Afyangu, the same credentials will be used to essentially log in into any portal that I've mentioned, because it will be the same as mentioned in the client registry that I had shown below in the previous presentation. So here, instead of now just using your phone number, you just use your ID and your 4-digit PIN. But just to also mention that you can also reset your PIN in the event that you forget, where you just need to add your ID number and your phone number as well. And then lastly, for the employer portal, this is where now employers can add their employees. I'm sure many people on the call today are hospital owners and business owners. So also to just ensure that they can have ease of adding the employees, they can do so on this portal. You can do so using previous NHF members can also upload their details here. And it's a simple form which allows you to do so, where you just need to add the employer code that you had and your number for NHF previously, your employer email, and there was an e-service password that was given during that time. And the required documents are listed here so that you know what needs to be added during registration. Similarly, for NSSF, same process. But for new business owners, there's additional information that would be needed to be added. But the required documentations are listed here. And then for any admin access, then the organization can set up an admin account in one step, and then you can then proceed to add employees as well. For domestic employers, for those who want to have their domestic employers like house helps, maids, security guards, they can also do so as well. All they need to do is create an account as a domestic employer, and they can also batch upload the details of their domestic employees as well. So pretty much that's the process of registration. Happy to hand it over to you, Dr. Amina, to proceed with the conversation as well. Thank you.
Thank you, Doctor. I don't know, is it possible for you to show us a dummy way of registering a child? Because there's been a lot of complaints around that. Is that practical? It's live, so it's a bit difficult for you.
I'm currently using the live environment, but I can stop before just adding the details just so that everyone is aware. Allow me to log in into my portal before I share my screen. Just a minute. I'm just getting an OTP code, and then I'll be able to log in into my account. Allow me to just share my screen. Great. If you can kindly confirm if you can see my screen. Sorry,
I can see it now.
okay. So as you can see here, this is the Afiango page that has my details. So you can do means testing, which Dr. Kabor or Mr. Kaboro will mention in a bit. But as you can see here, when I go to my profile, I can add dependents. And when I want to add a dependent, this is where I'll have access to my options as to how to add, as well as a spouse. So when I want to add a child, all I need to do is indicate the age group, whether it's below 18 or above 18. If above 18, you usually have an ID number, and all you need to do is add the ID number and their first name. That will check against the National Registry Bureau database just to confirm that that person actually exists. Or if it's below 18, all you need to do is then add the details here. However, I will not proceed because I do not want to populate a dependent that I do not have. But this is a simple process that will allow you to then add all those details as well. So I hope that that is clear enough.
Okay. Thank you, Dr. Ray, for that illustration. So before Kabugo can join, or we can just do the question and answers later. But for practicality, I think maybe just address a few of them. One person is saying, I've tried to register online, but I'm not able to proceed as it keeps asking me to add a telephone number associated to my ID. This is the only number I use. Is there something like that?
So currently, we appreciate that there are certain challenges when it comes to registration. Now, for every person who's registering, it's important to note that on registration or actually getting your SIM card, you are requested to add an ID number. So one of the key things that we are currently doing is that we are checking whether you registered that phone number against your known ID number. And it actually will not work if you're using a different phone number as well. But I recommend for such people just to confirm with the specific mobile network operators that that's the specific ID number that is linked to that phone number, because that's usually some of the issues that we currently face at the moment. Similarly, there are people who have registered more than one number to an ID number. So when you're trying to register, it would be important just to use one, because that would be the specific one that would be used for your registration process. However, you can add an additional number on the contact information form on the web portals as indicated. So you essentially do not need to have two mobile numbers registering at the same time.
And then, Dr. Just to make it a bit simpler, is there a way you can reach out? Is there like a support 24/7 number that we can reach out to in case of this challenges?
Yes, there is a SHA customer care team number that's on the SHA website. So if you call that number, you'll be able to get assistance from the SHA team.
So I hope you'll still be on so that we can complete the question and answers for registration later on. While you keep trying testing the systems so that we can have more questions for Dr. And Kaboro, how are you?
I'm good, Amina.
Hi, Kaboro. I personally can't wait to hear your presentation, so take us away.
All right, thank you very much, Dr. Amina. You just giving me a moment, I'll share the presentation. Yes, so good evening, everyone on the call. Allow me to take a moment to take you through the proxy means testing, which is part of registration. And this part of proxy means testing has actually been was indicated in the Act and in the general regulation of the Social Health Insurance Act that all individuals who do not earn a salary in the formal sector, who earn their income through any other means, including jua kali, including farmers, etc., they should be subjected to proxy means testing so that we can determine their income. And so from their income, we can determine how much they are going to pay for social health insurance. So this tool is actually a statistical analysis of a household to determine. So traditionally, it has been used to determine the household's welfare levels to know if a household is eligible or not eligible for government support or for social protection support. However, for the purposes of social health insurance, this tool has been expanded further to actually determine the income level of that household. So we are only focusing on the non-salaried people or non-salaried house. So those are households that do not earn a fixed salary. And we estimate there are about 80% of such households in Kenya. So around 11.2 million households are expected to undergo this process of proxy means testing. So the process comes immediately after you register. We will see how it is done. But once we determine the income, the Act actually regulates that we deduct 2.75% of that income. So what I'm going to take you through is how we do the means testing process. Now, for us to develop that statistical model, we had to use an already done survey. And for this, we found the Continuous Consumption Survey of 2021, which we could be able to use to train this model. We had a total of around 16,000 or 17,000 households in that model. However, after that, we have also done a further analysis with about 2,300 households, which come from low-income groups. So we have improved on what was done in 2021. Also, the data that we have collected finalizing last month. So what the model does is basically compare your income with all the socioeconomic characteristics that are there in that household. So we will look, for example, at your income that is statistically evaluated. And for that income, we will see which kind of socioeconomic indicators are associated with such kind of an income. And if you have a large enough household we can be able now to use that model to determine for all other households. So these households are usually representative of the entire country. They are statistically sampled by the Kenya National Bureau of Statistics. The Kenya National Bureau of Statistics actually, for this household, they usually stay with the households for over a period of 1 year. And for that 1 year, they'll determine how much income or how much expenditure these households are doing and income that they are deriving. And for that, so if we get this data and we try to analyze it against the socioeconomic characteristics of that household. And what I mean by socioeconomic characteristics, these are variable. I'll give an example. When we usually have 4 kinds of variables. So this is the household housing characteristics, access to basic services, asset ownership, and household composition. So, for example, under housing characteristics, we will look at issues like the type of floor, the type of wall material, or the kind of dwelling that you are living in, the fuel that household is using for cooking and for lighting. When we look at basic access to basic services, we will look at issues like toilet use, access to electricity, what kind of water they use for drinking, etc. When we look at the assets, we will look at issues like if the household owns a car, if the household has a fridge, the kind of land they have, the kind of land they utilize, etc. And when we look at the composition of that household, we will look at if the household is composed of mainly older, retired a couple, or is it a young family taking care of several children, etc. So we use this data to actually come up with a composite indicator that will allocate your income. Now, another thing to know is that we usually get these indicators both from what you register yourself when you're going through the means testing instrument in the module when you're registering. However, we have to actually verify and validate these indicators. So to validate and verify, we use various data sets which are already existing. An example includes the IPRS. This is where we register ourselves or we register our families with government. When you're getting IDs, we're getting passports, etc. We will check your energy use, for example, electricity bills, etc. We will also check if the children are in school, what kind of information has been filled in the school registration form. If you look at lands, we can see the land registry which has been digitized, and we also check that the information you're giving is the correct information. So we have a second layer to validate what you're saying, that it's the correct thing. Now, I won't go into the regression analysis, but basically that's how the model looks like. Allow me not to go through that for the time being, but show you how this model classifies the household. So once we have all these indicators, there are many indicators. They're usually around, possibly we can generate around 230 indicators from the questions you are asked and the questions that the government holds for you in our government databases. We can have around 230 indicators. However, please note that in the module when you're registering, you won't be asked all these kind of questions. I think there are more like about 18 or so questions that you'll answer. Very easy to answer questions. Very easy to answer. You can do that within 5 minutes and you're done with this part component of means testing. However, from all the other databases we have, we can generate around 237 indicators, of which after doing our statistical analysis, we have found only about 97 of these indicators are actually viable for use. So we will use the 97 indicators to actually classify. So the model will first classify a household whether in 3 categories, whether they are low-income household, whether they are middle-income household, or they are high-level household. So that's usually the first thing that the model categorizes. The reason why it does this is that for each level of income that you belong to, the next step, which is actually to compute your income, will the variables used for the different categories are different. So, for example, if you are in very high income category, things like mobile phone use will not be used. And when you're in very low income category, things like vehicle ownership will not be part of the variables to be used. Then the next part, the model also automatically now uses, based on the level of income, the 3 levels of income, the model will automatically know which indicators to use to actually estimate your wealth or your income, sorry, not wealth, your income. So it will estimate your income. And once we have your income, we can do a 2.7% of it. We have tested this model a lot. Actually, we have about 2,300 households which we have tested. For those who have filled, we also have a further about 23,000 or thereabout households which have filled these questions. And we can use validation mechanism to see if this model is actually giving us the correct income. Now, why do we have to do this? You remember Kenyans have been promised a benefit package, and this benefit package has to be funded, and specifically the component of social health insurance fund, which is the middle fund out of the 3 funds that are there in the social health insurance. Funding will come from individual contributions. So we estimate that if all Kenyans, we estimate the income of all Kenyans in the informal sector, We add what we are getting from the formal sector, those who are earning, we can generate around 148 billion shillings. This is also taking into cognizance that governments, both national and county, will have a group that they need to subsidize, and especially those who the model will see that their premiums are below the gazetted 300 per household. So with all this income, we'll generate around 148 billion shillings, and that is what constitutes the benefit package that you will be given. I think early on at 2 p.m. you are given the benefit package that will be funded by these funds. So with this high level presentation, I think we'll take it back to the group for any questions and comments. Back to you, Dr. Amina.
Thank you, Koboro, for giving us a good high-level overview. Maybe we'll go into technicalities, but thank you very much for that. So before I'll take it back and forth, so that both of you are able to engage the audience. So I will start with you, Kabogo. Does the mean testing account for more recent changes in economic status, such as job losses post-COVID or other loss of livelihood?
Yes, now two things to note. Number one, the model that we are using, we have actually, the actual indicators we got from the 2021 survey, but however, we have updated this with other surveys that are done by the National Bureau of Statistics. Specifically, every year they do the National Production Survey, which estimates our GDP. So we have actually updated the model to take care of such. Number two, when, for example, in between, if you lose a job, that's the time that you'll undergo means testing. So we will have a way whereby you can, the model actually, after the model classifies you, you are still given an opportunity to actually say if you feel that is okay or you really need to contest further. So we have developed other mechanisms. For example, if you say, I had a stable income selling a shop, but now I have lost that income, we are actually in the process of developing other ways which you can verify this to ensure that what you're saying, number one, is the truth, and number two, in case of such a loss, within a period of 3 months or 6 months, we should be able to know now your next income category, assess it, and give you the new premium. As you are aware, this premium is being paid yearly. So in between the year, in case of any change in socioeconomic status, the law requires that you notify the social health authority. I think there will be an easy way where you can do your letter and submit it to the social health authority, either online or in person. And with this, we will be able to actually see the new categorization that you are going to fall in, so that come the subsequent year, you are able to pay the correct premium.
Okay, makes sense. And I love how you had categorized in terms of the model was using the household, and then it had the a low, middle, and high level. I was looking at the figures, of who's a high level income earner, who's a low level income earner. Maybe you can shed light how we came to that classification.
Yeah, so this is done by both the Kenya National Bureau of Statistics and the Ministry of Social Protection. So they're the ones who develop guidelines, and they usually, if you peruse through the economic survey, they're able to give such figures. So we usually know that the most Kenyans who are employed, more than 80% of Kenyans actually, will be in the income of below 70,000. So and the average is usually around 35,000. That's the average for all Kenyans as income. However, we usually know that between if you fall below 20,000, now you're already in the category where you're being high risk. Below 15,000, you can actually be considered as very low income, where falling back into poverty is possible. However, anything above 100,000, which actually only about 13 to 15% of Kenyan households are able to get an income of above 100,000 shillings, that's now where we classify individuals as high income. I hope that makes it clear. But that actually is usually done by the National Bureau of Statistics and the Ministry of Labor and Social, I think Ministry of Social Protection and the Ministry of Labor.
Yeah, it makes sense, and I love how it's customized based on the data within the country. So it's not just high, low of America, for instance, or Ethiopia, or just random countries. It's the fact that it's locally bred data makes it even more practical. Maybe before I look into that, what about the challenges you faced while developing the means testing? Because it's it's one of the few that is actually being done in a developing country. What are the challenges you faced them? How did you overcome those challenges?
Yeah, I think what you just listed was our main challenge. And to correct you, it's not only in low income. So proxy means testing has been used worldwide, but its use has been different. It has only been used to classify households as whether they need social assistance or not. So just those two categories. If it is cash transfer, is this household eligible for a cash transfer of 2,000 or is it not? That's what has been, proxy means testing has been used all over the world for. However, for using proxy means testing specifically to classify or to estimate household income is something that has not yet been done. The country will be the pioneer in such kind of development. It's a pioneering work actually. And how we had to overcome that for the past 8 months or so, we had, I think, to bring into the country as many data scientists all over the world as possible. So we have had data scientists from West Africa, from Kenya, from other countries to come and brainstorm through this. We have also had to use a lot of effort of data scientists at the Kenya National Bureau of Statistics, who have actually been very helpful in coining this process. So it has been a challenge, but we have been able to overcome. I think that has been our main challenge when you are doing this work. The second, which is not such a big challenge, is how to link this work into the model, into the registration process, ensuring that yes, it requires a lot of information, a lot of data for the model to work, but we don't need to spend an entire day in a household trying to collect this information. So how best can we make use of government databases that have been developed over time, over the past 20 years or so, and that are updated well, that we can use currently? How can we be able to leverage as much as possible on that? So I think that's how we have managed to overcome that. We have had a lot of high-level support. So we have managed to mobilize support from any corner or within Kenya or any corner that source data that we wanted to engage. So that has been very helpful for us. It has been very engaging, and I think so far it has gone on very well. Thank you.
Thank you for the insights, and especially the work that you've put in. I'm sure it's not easy work at all. So I'll jump to Dr. Mandela. Could you kindly shed light? First of all, we were having engaging discussions with the county directors from the country today, and some of them were really against OTP number, sending an OTP. So Could you shed light why it is important for us to have OTP?
Thank you, Dr. Amina, for the question. So essentially, for any system that is ever built, the key question is how do you identify the user appropriately, and also how do you mitigate against fraudulent attempts to access a system or impersonate a user? So what are the key things that we currently have or are implementing? One is the OTP, which is a one-time password, which allows a user to authenticate themselves against their phone number. And because, as I mentioned earlier, the phone number is usually acquired in Kenya using a national ID or a passport. So it's very difficult for somebody to impersonate as someone else from that level. However, we also appreciate that this is not foolproof. And this is why we are also working to ensure that biometric capture is done appropriately, more so especially during facility visits, so that then we can ensure every patient is then appropriately identified in the ecosystem. Also, in relation to this, during the registration process, each patient or client has a unique identifier in the ecosystem. And this is actually the importance of the superhighway that is being built, because as Dr. Amina or as Mr. Kaboro or Mandela, each of us will have a unique client registry ID, which then will allow us to map ourselves not only to our medical records whenever we go to a facility, but even as providers and doctors, because we also have a license number that will also be uniquely identified to us. So that even when we are seeing patients, we can also be uniquely identified in the ecosystem. So this is why we're trying to set up various mitigation factors to, one, uniquely identify patients, but more importantly, to also mitigate against fraud as well.
Okay. Thank you for that. I think that's important because a lot of people don't like lengthy processes, and it's good to know why they need to go through it. And before I go to Kaboro, there was something that was mentioned earlier today. Does your spouse need to register so that you can add them as a spouse, or can you add them as a spouse? You know, how does it work on the system?
Thank you for the question. In light of the recently legislated Data Protection Act, there's a key component of it, which is consent of each and every single individual who is above the adult age, which is 18 years, for everyone who has an ID. And it was very clear that for anyone who's opting in into this process, that they adequately give consent to also not only be part of the ecosystem, but also to be added as spouses or even as dependents above 18 years of age. So as long as you have an ID number and by law an adult, then you'd have to register first, because that's how we would then validate that consent has been given, so that you can also be part of the ecosystem as a client and a patient as well.
Thank you. And I think it answers also a lot of questions on dependency adding. Some people have found it very hard to add their dependents in terms of spouse or children under over 18.
Yes, I can imagine that being a challenge, because then usually someone might assume that just because they're my spouse or my child, they would not need to register. But as previously mentioned about the Data Protection Act and its statutes, it's important that each and every single individual consents into the process.
Yeah. And in light of that, in terms of privacy, um, you know, a lot of people have complained, especially the people who have more than one wife, so that they can be able to execute this and have their household as one spouse or two spouses or three spouses. Now, in terms of privacy, how has the system addressed in a wife knowing that they are I don't know if can they see who, if their spouse has more than one wife? Maybe I let me go straight forward to the question.
So it's a very good question. So one of the key things, So there's a system bit of it, which is easy to answer, but then there's the policy and social aspect of it, which is might be quite difficult to answer. But from a systems perspective, the system assumes that every person who's added as a spouse, one is a consensual spouse, meaning that they have gone through the process of marriage, or even through traditional means, or even through an assessment of marriage through a chief locally. And therefore, there is some form of either documentation like an affidavit, a chief's note, or even a marriage certificate, which would then mean that the union has been done consensually between two adults of sound mind as well. However, then it's also important to note that not all of these circumstances usually pan out the same way. However, we also leave the discretion to SHA so that they can also make that determination as to whether a spouse is a spouse to a specific principle. In terms of privacy of that information, as you saw in the slides that we had shared, every single individual who is accessing any portal will have to avail themselves a phone number and an ID number, and as well as the one-time password that I had mentioned earlier, so that then in case somebody even has that, then there's also the PIN, which will also ensure that no one else has access to that information as well. So ultimately, the goal here is to ensure that we reduce the barriers to accessing vital, very critical information. But in the household level, you also saw there was a family tree on the client portal. So as a spouse to a principal, I'll be able to see myself on that. However, then it's also important to note as a system, it doesn't really necessarily always know that you'd want to hide a wife or a husband for that reason. So this is why I'd like to separate the two conversations as a systems one versus a social one. But I'll also allow Mr. Kabaro to chime in there as well.
Yeah, thank you very much. So Kaboro, before you expounded that response, there's some questions raising concerns on the funding model. It was something new. It came in, and one of the reasons why it had issues was not enough information. What's different? And perhaps maybe more scientifically, what's the confidence interval at the moment?
Yes, so this model is a little bit different from the university funding model. You'll notice that the university funding model is what you call simple means testing, which is basically scoring of an individual based on few indicators. So this one is using multitude of indicators that have been collected. And so far for the data that we have tested, we have been improving the model as much as we could. So we have been trying every possible scenario that we have data. We try to validate it. We try to test it to ensure that it improves the way it can predict an individual's income. Now, in terms of how you're asking about the confidence interval, so I'll not talk of the mathematical confidence interval. I'll talk of how confident we are that the model is good. So we are very confident with the model. The main issues we usually had before we have been able to correct over the past month, this whereby some households which ideally cannot afford much, they are being placed in a category where they are being asked to pay quite a lot, and that we have been able to correct into the model that we have finally developed. And so far, less than 9% of the population will fall into a category which maybe they are not comfortable with. So we do expect, and I have seen that in the Q&A, we do actually expect that there are households who will feel that, yes, I have these indicators, but I have been overpunching. I'm not really able to pay the amount you're telling me to pay. And for that, we have inbuilt into the system a second level of checks to ensure that this is the correct information, number one. Number two, we will be able to also use people on the ground to actually assess for this small fraction of the population that will feel that they really cannot afford. So we will have now physical validation. We will try to see as much as possible how we can actually validate this. But yes, we do have a population who we will expect they will classify. Number three, the households, of course, will try as much as possible to pay the least amount of premiums possible. So if I know, for example, somebody in the village is paying 500 and the model has told me to pay 1,000, I'll try as much as possible to see how much can I make noise to make sure I also pay the 500. So that second and third check will be able to contain and eliminate such kind of situations. Yeah, so we do expect, but we are very confident with the model as it stands at the moment that it is able to actually predict the household income very well.
Okay. Then just so that we build up to the conversation. How often does this means testing allow for updating to take care of drastic changes? Oh, sorry, you've already answered that question. There's a question, I think I lost it somewhere, but maybe I go back now to Mandela because Mandela seems to have a lot more questions. I registered using the USSD 147. Then I visited the online site of Afya Yangu. I was not able to register dependents, and also the issue of biometrics. It's still pending. We don't know where to do biometrics.
Thank you for the question. So currently, for biometrics, so we are trying to work very closely with the National Registry Bureau, which falls under IPRS. So essentially, this is the agency that is used to collect and store biometrics within the country. So there are two things that need to happen here. Number one, each and every single client that has registered, we have to validate their details against that database, which also has their biometric information. And then number two, we also need to ensure that at presentation, people can also validate the same biometrics. And how we're doing this is that we're working to ensure we empower SHA agents and SHA offices with the capabilities of now validating those biometrics as well. Currently, this is still work in progress, but we are working very quickly to ensure that that happens as soon as possible.
Yeah, and then earlier on, Dr. You had mentioned that employers also have a place whereby they can were they registering or were they confirming that the people who have registered are their employees?
So the employer portal, which is also found on the sha.go.ke website, allows for employers to add current employees who are initially under NHIF, but also in the event that they need to add additional employees who are not under the same obligation, they can do so as well within the same portal. This also allows the employees to also have the client registry ID assigned to them in this process of registration.
Okay, sounds good. Kaboro, can we get an example, a step-by-step example of a father earning 100,000 as the sole breadwinner, and how much he would be expected to pay looking at all the indicators? Just a hypothetical example. I don't know. It would be more fun if you could actually put the means testing live so that we can see how it goes about. But if it's not possible, maybe you can just give us a hypothetical example.
Yes, so maybe somebody who, and you'll find somebody who, there's so many indicators. First of all, let me indicate. So trying to give a hypothetical indicator, a hypothetical person will be quite difficult, but let me try. So you have a retiree who is 75 years old, lives in, let's say, Nakuru, in the outskirts of Nakuru town. They have built a stone house when they were working. So this stone house has 5 bedrooms. They have a septic tank. They don't have a car, but they have a TV. What else? They live alone. They are already retired, as I've said, 75 years old. They use electricity. They have piped water into their house. That household, most likely you find them paying between 500 and 800 shillings per month. So that would be high level example. And the reason why it's coming to between 500 to 600 is it shows that this person has already built something over the entire life. So most likely either they have a pension, they have a way of getting a small income, a house, they have built etc. So, but that's a very hypothetical example. Then you'll find those high level income, somebody who, for example, the system has integrated or have seen they live in somewhere like I don't know how many from here in Nairobi, but let's say somebody who lives in Karen estate, they already see they have constructed their own house. The house has, for example, 10 rooms which they are using. They have a landline, they have a mobile phone, they have a vehicle. That will tend towards premiums of between, and sorry, and it shows also they are working, so that, or they have a business they're running, so that will tend to between 5,600 per month. So that's a very high hypothetical situation. But on Monday, I think basically by Monday or thereabouts, households will be able to, or individuals actually in this call will be able to go through the module and see how it classifies them. I think we'll have a better conversation once persons are able to see their income. We can have more in-depth discussions.
Yeah, agreed, you know, and I don't know. Let me not give pitfalls, but I think in general, majority of Kenyans, I believe, we would have more or less accurate information or data regarding them, and I think that's the take home message and the most important. Mandela, uh, refugee and foreigners, are they able to register?
Thank you for the question. So currently not as of the moment, but we are working again with government agencies to ensure that we can have their details mapped, especially for refugees who have very sensitive information, which also requires us to be guided with the relevant agencies. As you know, most of these refugees also are under certain levels of protection. So it would be important to ensure that their privacy and security is our top priority. So we are currently working very closely with the agencies to ensure that is done quickly. But for foreigners, one of the key things that is of note or importance is that each foreigner that should or will be under this should have a work permit, and availability of a work permit means that you also have an alien ID. So we're also working with the same agencies to integrate the system so that now those individuals can easily also register for the same.
Great. Then in regards to phone number, do you have to have a phone number that is actually working so that you can be able, and do you even have to have a phone number or active?
Yes. So for those without phone numbers, there's the assisted application which we are giving out to CHPs and SHA agent officers so that they can also assist those without phones at all. But they do have to have some level of identification. In this case, could be an ID number for especially adults, and for children, at the very least, a birth notification. But we also appreciate that in some parts of the country that is not possible. So we work together with the SHA agents to, under their discretion, to also determine the validity of these kinds of cases. And then for those with phones, at least they should be mapped to an ID number. So it means that when you're registering a phone, it's linked to an ID number so that then you can proceed with the self-registration process.
Okay. If somebody is, let's say, in Ushago and you want to register them, so how does assisted only work for SHA agents and CHP workers? I can assist my relative. I can assist an elderly person who is unable to do it. Is that platform accessible to anybody who wants to assist, or is it just specific to those two?
Currently, it's only limited to specific sets of individuals, as previously illustrated. But we also understand that that demand for registration will increase, and we'll also work closely with the Ministry of Health to also determine who those other categories can be added onto this assisted journey. But to be honest, also the web portals that I highlighted can also be a form of assisted registration. The challenge, however, is that you'll have access to someone's PIN, which we do not recommend. So obviously, that's why we're using the assisted journey to prevent that kind of thing from happening.
Thank you. And I think that's very well thought through. And it's easy to get a CHP worker and a SHA agent in the event that you actually need to register, hopefully. Taboro, for salaried individuals, is means testing still applicable?
No, it is not applicable for the salaried persons at the moment. So at the moment, if they are salaried, we know we have already deducted your 2.75. We want, I know why people are afraid is because people have properties, they have other sources of income. So at the moment, we are not going after this. So we get your salary, we deduct 2.75, you are eligible to benefit.
I like that. I like that. The fear is real. However, just to put a perspective to it, it's just basically people who, if you're salaried, do we have a baseline for the number of salaried people? Because I would be interested to know if we would have an increase in salaried people in the next 1 year.
Yes, we do have these statistics. We actually have the actual statistics for salaried and those who are working in the informal sector. So salaried in Kenya usually hovers between 19.7 to around 20.5% of all people in active employment. And then are between 79 and 81% fall in the non-salaried but still earning an income, no matter how small or how big it is. So those are statistics which are available, and they actually published. There's a report, there's a labor market report that is usually released every, if I'm not wrong, every 6 months or so. So we usually have that data.
Okay. So my employer submits 1,700 shillings to NHI for SHA monthly. How can I know my benefits and that of my dependents? Kindly note, I've never used it before. Kabor.
Sorry, I didn't get that question.
Zephania is saying, my employer pays 1,700 to SHA or NHIF every month. How would I know my benefits?
Oh yes, the benefits are actually going to be published most likely tomorrow or within the week, and this is something which will be shared through to everyone. It is also available online, so anyone has actually, even at the moment, everyone has access to this. If you go to the sha.go.ke, you can download the benefits and even the tariffs or the amount of money that these facilities will be reimbursed for each service they offer to you. So this will be available. Number two, it will not only be available for the salaried. So either if you're paying, there are those who will pay 20,000, for example, MPs, and there's the usual person who is very poor, they can't afford, so the government will pay for them, or they will pay 300. They'll access the same benefits. Everyone will have an equal benefit. We will move away also from the issue where before we had civil servants having a special cover. So even civil servants, no matter the rank that you hold in the civil service, from the president to the sweeper, you still have the same benefit package.
Okay, so a great question here from Dr. Ann. For the people who want to have, for charitable organizations, do they have to go through an assisted personnel to be able to pay the premium payments for certain individuals? Is that, do you think it won't cause a barrier?
So for those who are, okay,
sorry. You can answer, Kabur. Go on.
Yeah, so for those who are assisting households to pay their premium, we know there have been many organizations that were assisting households to pay their premium, including government, both the national and county. They will still be able to submit their list of individuals that they want to support. That work is not being done by the Ministry of SHA. It is up to the county government and the individual organizations to get their list of people they want assisted. And if they submit this list to SHA, there is already the gazetted premium which you pay, which will be the actuarial premium. It will be communicated to this organization. Whether the individual who are being paid for needs to do means testing or not, I think that's something which we will have to make an administrative decision on. But the premium for those who are assisted by organizations will be done, or we will be there to be able to be incorporated.
And then do we factor in disabled people? And then sorry, somebody Penana was asking, and she said great presentation. Do you mind showing the slide, the part for the formula? She just wanted to have a look at it while we are continuing with the Q&A. Kindly, if you can do that.
Okay. I think I can send to her, but my laptop actually has gone off, so I'm using my phone. But I can share with her.
Sorry. Yeah, sorry. Let me try and see. Try and see if I can do it on my end.
Yes, number two, to learn through it, we are using logistic regression modeling. So if you are familiar with machine learning, you can try logistic regression to just understand how we are doing the means testing model.
Sorry, Kaboro. I just to expound on the helping part. What happens to the people who are supported and people used to pay like 1 year in advance? How is that factored in? Is it just going like a liability, or is it going directly to your SHA account once you register? Is it like a process, or is it an automatic thing?
So for those who are assisted, even previously, NHIF used to charge or used to get annual premiums for those who are assisted. So those assisted by counties, they used to agree on how the annual premium is going to flow to NHIF, and once the premium gets in, the individuals are covered. So the same process will apply for those who are getting assistance. The premium rate payable is already determined. So of course, it will be very difficult to operate with monthly, since they are already in the informal sector. So it's very difficult to operate with monthly premium. So the law is clear that the premiums have to be paid annually. Now, in terms of accounting from the SHA end, of course, this annual premium will be accounted on as-is basis, what the accountants call as-is. So only what is within the period which has been paid. So, for example, if you pay for 3 years, the premium which SHA will consider and which will be used will be the premium for only the year that the person is in, and for the other 2 years is actually registered in the system as overpayment, which can only be accessed even by the SHA themselves in the subsequent years. So that is also happening, for example, for those who overpaid for NHIF. So if you had overpaid for NHIF, you remember the law is that premium you had overpaid is not getting lost. So that premium will be part of the amount that SHA will be required to pay for SHA. So so nothing will be lost, and every amount paid will be charged during the year that the person is being covered. But the premium, of course, is paid yearly. It is not paid monthly.
Okay, so the system captures yearly updates, and of course, it will be based on your means testing. So, for instance, if somebody paid the 6,000, assuming they paid the 6,000 from October, if it can be more if the means testing is at 300, or it could be less if the means testing is calculating your 2.75 more than 500. So the system will automatically say there's an overpayment of this much that has been done. In regards to cash refunds, I guess is it clear if we're going to have that?
No, you're not going to have cash refunds. What you're going to have is overpayment.
Okay,
You know, in government,
it's good to ask, man. It's good to
systems,
hope. It's good to
very,
hope,
very,
yeah.
very hard
Hatujui
to get
kuregesha
cash
pesa.
refunds, yeah.
Yeah, but yeah, so kind of makes sense. Sorry, Priscilla, I'm unable to share the slides as well on my end. My gadget is also very low. There was a question in terms of taking into consideration the level of incomes and means testing, identifying low income level on average. Is the 148 billion sufficient in the scheme? Is it adequate?
I would say that there is no amount that is adequate. So what we decided, you remember when we started doing the actuarial work for the benefit package, and looking at what Kenyans were really yearning for, a package equivalent to that of a high income civil servant that we, in previous regime. So we required around 230 billion shillings. And we also noted that if we need to get that 230 billion shillings, we would need to deduct Kenyans 6%. I think what went to parliament under the previous regime was 6%. But Kenyans also again said 6% is too much. So we have to ask with also how much are Kenyans willing to pay for this package. So we balance how much can we get, and for that that much we can get this the benefit we are able to offer. So there is an actuarial process that goes in between there. But for this 158, that's the benefit that we have developed so far. Now there are two things. One, the actual money that will come once we start deductions could either increase or be less. And for that, there is the provisions within the act that the benefit can be reviewed according to how much or the changes in the cost of delivering care. We could go and even Kenya say, this package is very good. We also now, we are ready even to pay 4% of our income to get even a better pay. So once we do 4%, we'll be able to do our yield analysis. Then we'll do our actuarial analysis and say, now we will increase this package to this much. So the package that we have currently is based on what we are foreseeing to get from the premium.
Yeah, and personally, my hope is we can reimburse based on quality, because it's a gap, and hopefully it's a gap that will be addressed with time to reimburse also based on the quality of service being offered, because I mean equipments are different. So Brenda is asking, observing social characteristics may be subjective. Many Kenyans are living beyond their means. How do you check or correlate the observatory findings objectively? Case in point, guys have big phones, iPhones and what have you. Maybe they were given, maybe they really went deep into their pockets to buy it. How, if you're using those indicators, how have you factored that in?
A very varied observation. So when we were starting, that's one of the first things that we noted, that the model can pick some of the indicators that somehow, you are calling it overpunching. Some people will overpunch. You'll find somebody in Kibera not having an income, but they have an iPhone and a laptop. And sometimes they, you don't even know how they got them, but they have them and they will be picked by the system. So what we have done is to statistically adjust for such. So once you have all these indicators, there's a way you can cross-correlate between all of them, all the indicators, and realize that, yes, this person has has even a vehicle, but looking at all these indicators, he's struggling in one way or another. That is one. Number two, you will notice that the other cases where people try to live beyond their means for a long period, you notice that that is usually very difficult to do because it's the same thing that has happened to Kenya. We have been living beyond our means for 10 years, but we are now going back to live within where we can afford. So somehow if the socio-economic characteristics adjust themselves over a long period of time. So we feel those two things. One, the model will adjust. Number two, you can't live beyond your means too long that the socio-economic characteristics change and stay the same for such a long period of time.
I like that. I love the challenge that you keep learning and learning and factoring in, and the fact that it's dynamic and um you can always change and improve. That by itself is key and fundamental. Then I think for the sake of time, sorry, I will be unable to ask all of these questions. However, I hope these sessions have been insightful. I will be taking down all the questions that have been asked. Try and get sessions that will inform the sessions and the users better and the audience. My appeal is, as healthcare workers, honestly, this is our sector. Let's work together. Let's ask each other questions. Let's challenge the systems and make them better. Kaboro, thank you for your time. Thank you for not just your time today, but just generally giving the time to work out something that has never happened. And we are behind you. We hope it works well because, I mean, it's our health at stake. So what's your parting shot, especially through the whole journey? What's your parting shot?
Yeah, so this journey has been in the works for the longest time. I think for the longest time, we have never, as a sector, had the kind of support with regard to leadership, the kind of, even the courage itself. You know, this is not a walk in the park. And, you know, most of us, or most of the people who have come when this work was ongoing, they have actually stayed away from it because of the complexity and the courage needed actually to implement it. So now that we have a government that is supportive 100%, that is willing to work, I think it's the honors of us as healthcare workers and individuals to support the government in this initiative, number one. Number two, to also understand that this work will be work in progress. A reform is not a one-stop shop where you do one thing and everything becomes perfect the following day. It's something that needs to work. We will need to continue doing it. We will need to continue improving systems. Not everything will work 100% in the first day. So everything, we need to be patient and ensure that we give the support because these are necessary reforms. If we don't do these reforms now, most likely we will reach a situation whereby we have a healthcare system which is actually not even possible to reform again, or it will be difficult. So it's best that we support as much as possible and give all our support to this one. Thank you, everyone.
Thank you too. Thank you for sharing your message of hope that our systems are going to get better. So tomorrow is a big day. Let's hope the ruling will come into the favor of the ministry. Otherwise, it's going back, I don't know how many months, but nonetheless, it's for the best. So thank you everybody for joining in. We'll try and have one session per week now as opposed to 3, and keep it live. I'll try and see how best we can do the next session. Thank you. Thank you very much for joining me. Good night. Good night, Kaboro.
All right. Good night, everyone.